Good morning, good afternoon, good evening, wherever you are. Thank you so much for joining this live stream and for joining me today. I also want to welcome any of you who watch this on replay. Today's topic is intensive care at home specific, the very 10 reasons why you need an NDIS nursing assessment for medically complex disabilities. So this is today a live stream that is unique for our Australian viewers that are having complex disabilities, or for any family member that has a family member with complex disabilities. And we are talking mainly about ventilation, tracheostomy, or long-term ventilation and tracheostomy without ventilation, ventilation without tracheostomy. We're talking about neurological condition, seizure management. We are talking about complex disabilities such as, when people need TPN, IV antibiotics, IV potassium, IV magnesium. That's what we will be covering today. Obviously, this is, like I said, intensive care at home specific for our viewers in Australia. Before we go into today's topic, what makes me qualified to talk about today's topic? Once again, my name is Patrick Hutzel. I'm the founder and director of Intensive Care at Home. And I'm a critical care nurse by background. I have worked in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years in critical care. I have been running intensive care at home in Australia since 2013. I was also involved in the early 2000s in setting up intensive care at home in Germany, in Munich, as part of a private organization. And we were the first ones doing intensive care at home in Germany. So I have a broad range of experience in intensive care as well as with intensive care at home. We have been NDIS accredited pretty much from day one here in Australia, and I will talk more about that. I am also running a consulting and advocacy service for families in intensive care at intensivecarehotline.com, and we've been doing that since 2013. And we have saved many lives with Intensive Care Hotline, as much as we have saved many lives with intensive care at home. So, without further ado, let's talk let's dive into today's topic about the very 10 reasons why you need an NDIS specialist nursing assessment when you have a loved one with a complex disability, or when you have a loved one with a disability. In intensive care or at home already. Once again, with intensive care at home, we are currently operating all around Australia. And currently operating all around Australia. We are NDIS accredited. We are TAC accredited and WorkSafe accredited in Victoria. NDIS obviously is a nationwide initiative. We're also an iCare approved service provider in New South Wales, as well as NIISQ in Queensland, DVA, Department of Veteran Affairs, all around Australia. We are also having received, or we have received funding through private health insurance, departments of health, as well as private health funds. So let's look into the 10 reasons why you need an NDIS nursing assessment for complex disabilities. So once again, what are complex disabilities in the NDIS world? Well, complex disabilities are often, disabilities that lead to the need of mechanical ventilation, tracheostomy, or they need to a tracheostomy without ventilation, or they lead to ventilation without a tracheostomy, such as BiPAP, CPAP, or they lead to the need of TPN. TPN stands for total parenteral nutrition, which in essence means intravenous nutrition. There's then also the need for a central line, for a PICC line, for a Hickman's line, or for a port, which are all things we can manage with intensive care at home. With intensive care at home as well, we are sending critical care nurses into the home 24 hours a day for clients that otherwise would be stuck in intensive care long term, or would potentially receive palliative care in intensive care and would die. Whereas if we take them home, we can improve their quality of life, and in some instances, quality of end of life. But many of our clients would have been in ICU for a long time, and many intensive care teams would have palliated them. Whereas we are an option to prolong life at home, often for many years. So the biggest challenge for families in intensive care in situations like that is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Right? So we are bridging the gap between hospitals, complex discharges, and home. Right? But we're also bridging the gap for patients that are at home already, or NDIS participants that are at home already, that don't get the right level of support and that are at risk of hospital readmissions, ICU readmissions, and they're at risk of dying. Case in point, we had some clients at home in recent years where the NDIS was only funding night shifts and wasn't funding the day shift for critical care nurses. And those clients passed away during the day because the NDIS was negligent and not funding the day shift ICU nurse. And then support workers or family members couldn't manage medical emergencies on ventilation, tracheostomy, right? And it's been gross negligence from the NDIS, and that was in the earlier days of the NDIS, when NDIS was funding nursing care. But obviously, they've been negligent in other cases too in the meantime, and they're trying to send support workers to patients with a ventilator and a tracheostomy. That is negligent. That is like flying the airplane with a cabin crew instead of the pilot. And if that happens, patients go back to hospital all the time, they go back to ICU all the time, or they die. And then everyone is trying to sweep it under the carpet and no one can be held responsible, right? Whereas it's the funding body that is responsible, not putting the right level of care in the first place, right? But it's also the fault of the organizations that take on work they shouldn't take on. They're not qualified for, right? Intensive care at home, we are the only organization in Australia in 2024 that actually has accreditation for intensive care at home, that has accreditation to look after long-term ventilated adults and children at home with tracheostomy, right? We are the only provider in the country that has third-party accreditation to look after patients at home on a tracheostomy, that has that level of accreditation, and other providers simply don't have it. Same with home TPN, we are the only provider that has the level of accreditation to provide that level of service. Now, without further ado, let's look at the 10 reasons why you need an NDIS nursing assessment for medically complex disabilities. Now, I do need to go one more step back because it is such a, sort of complex topic. I'll give you a real world example now. So currently we're having an inquiry from a patient with a tracheostomy living at home, but is going into hospitals all the time, right? Patient has been at home with support workers and family members, but going into hospital, it's just a level of care that it's not appropriate, it's not sustainable, and this lady is at risk of dying if she doesn't get 24-hour nursing care pretty quickly. So What needs to happen in a situation like that? First of all, there needs to be the right NDIS support coordinator, right? With the right NDIS support coordinator, everything can change, everything can be turned around. An NDIS support coordinator knows how to advocate with the NDIS for the right level of care, knows what reports need to be done, knows who needs to be on the team to get 24-hour nursing care, for example, right? And if you're not having the right NDIS support coordinator, you will be fighting an uphill battle, you know. So we have our own NDIS support coordinator, right, Amanda, and she can help you with all of that. She speaks the NDIS lingo, whereas we speak the clinical lingo, right, and we can advocate on a clinical level. But there's also a lot of NDIS language that needs to be, you know, that people need to know about, and they need to know how to speak to the NDIS and advocate in the right way. So in a situation like that, just like I mentioned with this client with the tracheostomy, a change of circumstance and a plan review needs to be triggered, right? And when that is triggered, then a number of things need to happen. And there needs to be an OT assessment, a functional capacity assessment. There needs to be an NDIS nursing assessment. There needs to be a physio assessment, right? And there needs to be a doctor's letter as well. Now, when it comes to the NDIS nursing assessment, right, that leads me to number one, why you need a specialist nursing assessment is that because we have unique NDIS knowledge and we know how those nursing assessments need to be written, right, you know, not many providers know about that. So for example, when you need to advocate, or when we advocate for nursing care through the NDIS, the whole report needs to be brought back to the disability, not to the health issues. So for example, if you're advocating with the Department of Health, you know, for funding for nursing care, you can talk about the health issues a patient or a participant has. With the NDIS, you need to talk about the disability first and then lead it to the health issue. Only then will the NDIS fund the nursing care if the primary issue is the disability that leads to the health issues. For example, case in point, you know, we're looking after some patients at home with MND, motor neuron disease. The motor neuron disease is the underlying disability that leads to inability to breathe, which leads to the need of a tracheostomy and mechanical ventilator, right? So in isolation, the ventilation and the tracheostomy is a medical issue, but it's actually triggered by a disability, right? And the report always need to be linked back to the disability causing the health issue. And that's when the advocacy works. The NDIS will then fund the nursing care, right? Once again, mechanical ventilation and tracheostomy is the skill of an intensive care nurse, not the skill of a support worker. It's not even the skill of a registered nurse without intensive care experience. Once again, sending registered nurses without intensive care experience or sending support workers to a ventilated client, that is negligence, it's madness. It's like flying the airplane with a cabin crew instead of the pilot, right? And patients have died because of it, right? And they will continue to die or take significant harm if that practice continues. It's actually also not best practice. It's also not evidence-based practice. So if you go to our website, intensivecarehome.com, you will find a section on our website, the Mechanical Home Ventilation Guidelines. And the Mechanical Home Ventilation Guidelines are actually evidence-based. The evidence there clearly shows that only intensive care nurses with a minimum of 2 years intensive care nursing experience are safe to provide care at home for a ventilated and tracheostomy client, or if someone is not ventilated but has a tracheostomy, needs 24-hour intensive care nurses. Once again, those intensive care nurses need to have a minimum of 2 years ICU or pediatric ICU, or sometimes ED, emergency department experience as well. Now, those guidelines are a result of over 25 years of intensive care at home nursing in Germany, and they are a result of over 10 years of intensive care at home nursing in Australia. And because patients have died, if they're not getting the minimum standards, which is 24-hour nursing care with critical care nurses at home, patients have died, patients go back to ICU all the time and are at high risk of dying. And you're more than welcome to contact me, you know, if you want me to show you evidence that patients have died because of it. you're more than welcome to contact me at intensivecareathome.com. You can call us there on one of the numbers. You can ask for me. I'm more than happily showing you the evidence if, in case you are questioning what I'm saying. So that's the first point. So the unique knowledge about how to write these report. Number two, the clients that we are advocating for, the clients with complex medical disabilities, are generally speaking on life support. Now, what does that mean? If a patient is on life support in a hospital, they are in intensive care, right? Or the lowest level of life support might be BiPAP or CPAP, and sometimes patients can be on a respiratory ward. But generally speaking, 99% of patients on life support are in intensive care. So if the NDIS says we can use support workers or general registered nurses, why are we not having support workers or general registered nurses in ICU in a hospital? Please answer that question, right? So, well, those patients would be dying without an intensive care nurse, which is what's happening in the community if they're not looked after by intensive care nurses with a minimum of 2 years ICU experience, as is evidence-based by the mechanical home ventilation guidelines that I just mentioned a minute ago. So to write a nursing assessment for patients on life support, that requires the skill of critical care nurses, right? It doesn't require the skill of a registered nurse, doesn't require the skill of an enrolled nurse. It requires the skill of an intensive care nurse. Our people that we have on our team that write our NDIS nursing reports are critical care nurses. 2 of them also have completed a legal nurse consulting degree. So they combine the reports, not only the clinical side of things, but also the legal side of things, i.e. if the NDIS continues to be negligent with some clients and won't fund the nursing care, they are also liable, and they are liable if something happens. So that all needs to be in the report, so it's actually documented that if something was to happen down the line, God forbid, because the NDIS isn't funding what's clinically appropriate and what's appropriate for the level of disability, that they can be held accountable. Next, an NDIS nursing assessment needs to tie in with an OT report, occupational therapy report, needs to tie in with a physio report, and needs to tie in with the doctor's report, right? So all the reports need to be aligned, right? And that is usually no issue if you have people understanding intensive care and intensive care at home, So very simple. You need to have the right people on the team to make things happen, and you need to have the team aligned to say the same things to the NDIS, and which isn't difficult when someone is on a ventilator with a tracheostomy. They're also often, most of the time, they're bedbound. They have an inability to move. So, without 24-hour nursing care, without 24-hour ICU nurses, they'll be dying regardless, That leads me to number 3. And number 3 is, that the alignment of those reports creates the right multidisciplinary team. It's very important that, when you get the reports together for the NDIS, that you have the right team. That's the right team starts obviously with the right advocacy, starts with intensive care at home. We have our own NDIS support coordinator. It continues with the OT, it continues with the physio, it continues with the doctors, right? And once you gather all these evidence, the NDIS can't really refuse, because when the evidence is overwhelming, what are they going to do? They wouldn't take the risk to be negligent, right? But it has to be the right level of advocacy, and the pressure has to be applied. So the right team is critically important. And when we work with clients here at Intensive Care at Home, where we send critical care nurses into the home 24 hours a day for our clients, I believe we have the right team. Otherwise, it wouldn't work. Next. Families lack insights. They don't really know where to start. and they think whatever an NDIS support coordinator or an NDIS planner is throwing at them is just what it is. You know, patients have no idea, or NDIS participants and their families have no idea that they actually have rights, you know, but you need to exercise them, and you also need to know where to get those insights, right? You need to know where to get those insights, and you need to have the people that have dealt with the NDIS, you know, how to speak to the NDIS, how to speak to NDIS planners. Also, what's also important is you need to find a complex NDIS planner, right? If you don't have an NDIS planner who understands the complex disabilities, don't deal with them, ask for a different one, you know. And you need to know what team to assemble. You know, if your NDIS planner working for the NDIS is not a complex disability planner, sack them, get a new one, right? Because they don't understand the complexities. An NDIS planner that's working in the complex disability world is much better than a general planner, right? Because they have a much better understanding of what you and your family need, right? And that leads me to the next point. It is critically important that you know where to find the relevant expertise. Again, I'll give you another example. Sometimes we get calls from NDIS support coordinators who say, hey, I've got this patient here in ICU and they're on a ventilator, they're with a tracheostomy, and they've got an NDIS plan for 24-hour support workers, right? And they asked me, can intensive care home take this patient home? And I said, that's a death sentence to provide 24-hour support workers for an intensive care patient. That's a death sentence. And like I said, patients have died because of it. So that leads me back to A, you need a good NDIS support coordinator. Number two, you need to know where to find expertise, right? You know, NDIS support coordinators who want to find a provider for 24-hour support workers for an intensive care patient, they are negligent and they don't have the level of expertise that is needed to help your family member in a situation like this, right? If an NDIS support coordinator comes to me and, you know, brings a situation like that to me, you know, one of the questions that I'm asking is, and what makes you qualified to make decisions or potentially advocate for an intensive care patient? And I get silence, right? You know, we employ hundreds of years of intensive care nursing experience on our team, hundreds of years, right, combined. And combining that level of expertise with an NDIS support coordinator who's well versed within the NDIS language, that's really rocket fuel for the advocacy, right? So it is critically important that you know where to find expertise. Once again, the nursing assessment is a critical component, but it is very important that you have the right people on your team. At the moment, we are working with a client who is dealing with an NDIS support coordinator who didn't want to advocate for nursing care for tracheostomy ventilation. I'm keeping this very private here, but you know, client is now talking to us because the client is realizing that the other NDIS support coordinator is completely outside of their depth when it comes to ventilation and tracheostomy. They are very negligent, and they would just let the client go home with support workers, which once again is a death sentence, right, in many cases, right? So it's critically important that you align yourself with people who know where to find the area of expertise. Next point. You want a smooth hospital discharge, right? You want a smooth hospital discharge, right? And here's what I mean by that. Recently, in April this year, we have done some shifts with a tracheostomy client here in Melbourne. And, you know, we only did a couple of weeks. Tracheostomy client went home earlier this year after a long hospital stay. And went home with a tracheostomy, not ventilated, but, you know, patient is paralyzed. And then one day we get a phone call saying, oh, you know, we need some nursing shifts. Can you help? We've heard about intensive care at home. Can you help? So we went there, started doing some nursing shifts, but we also knew the NDIS plan was running out in a couple of weeks and there was no more funding. And then the client went back to hospital because there was no more funding, right? Now, but here's another thing that the family told us at the time when the client first went home. There was some funding for nursing care. And then they went on to Mabel. Mabel is like the Uber for the NDIS. You basically look up people's profile on the Mabel app, and then you can select registered nurses, support workers, and whoever else might be putting their resume on that platform. And then those registered nurses showed up at the client's home, and as soon as they saw a tracheostomy, they walked out again. So what that means is, once again, like I said earlier, not even a registered nurse without ICU experience knows how to handle a tracheostomy, right? And that's what I mean when, you know, if everything is in place, if everything is lined up, you want a smooth hospital discharge. Another benefit of intensive care at home and having the appropriate nursing funding is we keep our clients home predictably, right? So this client already had multiple hospital readmissions because the funding wasn't there. The level of expertise wasn't there, even if the funding was there, right? And the hospital discharge did not go smooth. He's already bounced back into hospital, right? You don't want any of that. You don't need any of that drama. You want to go home and you want to stay at home and maximize your quality of life. And you want to have the service that makes that happen predictably, which is what we do with intensive care at home. I mean, like I said, we employ hundreds of years of intensive care nursing experience in the community. We are actually accredited for intensive care at home. No other provider has that level of accreditation or has that level of expertise and intellectual property than we have with intensive care at home. So, you know, you want a smooth hospital discharge, and an NDIS nursing assessment will lead to that. Now, let's move on to our next point, number 7. I briefly hinted to that already, but I think it's even more important that I mention it again. So your internal team needs to comprise of a level 2 or level 3 NDIS support coordinator who actually has dealt with complex disabilities, who actually knows how to advocate for nursing care, right? That's number 1. You need the right nursing team, which we can provide for you. You need the right OT. You need the right physiotherapist, right? You need the right speech therapist. You need the right team to make things happen for you, or also includes your doctor as well. But I hinted towards that earlier. You also need the right NDIS planner. So the NDIS planner is someone working for the NDIS, right? They approve your plan, right? But that needs to be a complex NDIS planner, right? So like I said, you know, I believe the level of incompetence at the NDIS is pretty high, right? Most of them are bureaucrats. They are not clinicians. They don't even know what they sign off on. The complex NDIS planners are probably in a little bit of a different category. They often do know about complex disabilities, and they do know the level of risk. They do know the level of care that is needed for those clients. So if you're a family member or if you yourself, you know, are dealing with ventilation, mechanical ventilation, tracheostomy, neurological conditions, seizure management, PEG tube, you know, management, TPN, central line management, port line management, IV potassium infusions, or palliative care, you need a complex NDIS planner, right? If you don't have a complex NDIS planner, you need to sack them and you need to ask for one, right? It's inevitable, right? Once again, a good NDIS support coordinator will also be able to help you with finding a complex NDIS planner, right? So your NDIS support coordinator plays a critical role in when you have a complex disability. Okay, so next reason why you need a specialist nursing assessment is leading to, you know, my previous point, that you want a smooth hospital discharge. You want to avoid hospital readmissions. So once again, giving you another real world example, you know, in the earlier days when we first got started with one client, there was a client who was at home ventilated with a tracheostomy and a ventilator, and he went back to ICU almost every second day because he either had no staff or he had incompetent staff, right? He had support workers predominantly, or he had registered nurses without intensive care experience, and he was going back into hospital all the time because, you know, that provider could not keep him home. That was actually our first client. Well, within a few days of us rocking up there, we were keeping him home. And more importantly, we were keeping him home predictably, right? He never, ever went back to ICU when we worked with him. That's our promise, right? And, you know, that is our promise and that stands, right? Like I said, just with this other client who went back to ICU recently, you know, when we were there for a few weeks, it was only a few weeks because of, you know, the funding was running out. And again, the NDIS support coordinator that would have managed that, you know, would have been sheer incompetence, letting funding run out, you know. And the goal is for you not to go back to hospital, or for your family member, or for anyone in that, for that matter, unless it's something elective, unless it's something planned, you know, maybe you need to go for a procedure or whatever the case may be. But the goal needs to be to stay home predictably. Once again, this is what we do at Intensive Care at Home. Our clients stay home predictably, right? And that is all mapped out in NDIS nursing assessment. You know, how do we actually achieve avoiding the hospital readmissions? Now, number 8, and again, I hinted towards that, but I feel like I need to break it down in much detail, simply to avoid death, right? Once again, many patients at home with ventilation, tracheostomy, seizure management have died because they didn't have 24-hour nursing care at home with intensive care nurses, right? So when someone is on a ventilator and a tracheostomy, they are on life support. Once again, if patients in a hospital are on life support, they are in intensive care, right? And they need doctors and nurses around them that are competent to deal with life support 24/7. Now, we don't need a doctor at home on site like they are in intensive care, but you need a critical care nurse 24 hours a day. Once again, that is evidence-based. Have a look at the mechanical home ventilation guidelines that are evidence-based on our website at intensivecareathome.com, right? I can't stress this enough, that going home without intensive care nurses 24 hours a day when it comes to ventilation, tracheostomy, when it comes to tracheostomy without ventilation, when it comes to ventilation such as BiPAP, CPAP, could be a death sentence. And once again, I have evidence for what I'm saying here. Please reach out to me if you want to know more. Number 9, you want, that's actually number 10, you want to maximize quality of life, and in some instances, quality of end of life. What does that mean? Well, if you're stuck in hospitals or in intensive care, there is no quality of life. And at home, there is quality of life. If you're at home already and you have insufficient support because you have support workers and there's gaps in your roster, and you know that support workers are incompetent, they don't have the expertise that you actually need to keep your home predictably and live your life, live a good life, you know, once again, you urgently need to reach out to us before it's too late. Your life is at risk and you don't even know it. Might be fine 364 days of the year. If your tracheostomy blocks tomorrow and the support worker doesn't know what to do, you know, that could be a death sentence, right? I wish I had nicer things to say here, but that's just the reality of me having done this work for the last 25 years. It's just the reality. I'm well aware of the risk. And, you know, you need to face reality you need to look in the eye of reality. Otherwise, you are putting yourself or your family member at risk. So that concludes the 10 reasons, you know, why you need a specialist NDIS nursing assessment when it comes to complex disabilities. You know, you might be watching this and you might be dealing with other funding bodies such as private health insurance or, you know, TAC in Victoria, maybe NIISQ in New South Wales, NIISQ in Queensland, and iCare in New South Wales, maybe DVA. We can write other nursing assessments too, but Now, more and more is moving towards the NDIS, and therefore I thought it was very important to break down the complexities of the NDIS and how we can help, right? So that is very, very important. Now, if you have any questions, I also encourage you to type your questions into the chat pad here, or if you do want to get on live on the show here, I can get you on the show here, and by you clicking on the link here, and you can talk to me directly, right? Now, once again, with intensive care at home, we are currently operating all around Australia, in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around Australia, including level 2 and level 3 NDIS support coordination. We are TAC approved in Victoria, WorkSafe approved in Victoria, iCare and WorkSafe approved in New South Wales, NIISQ in Queensland, DVA around the country. We have also received funding through the through departments of health, through public hospitals, as well as private health insurance. So please reach out to us if you have any questions around that. Like I said, we also provide level 2 NDIS support coordination, level 2 and level 3 NDIS support coordination. We have also sent our critical care nurses into the home to bypass ED, emergency department. So we have worked for the Western Sydney local area health district, and we have sent for the In Touch service, and we have sent our critical care nurses into the home to prevent emergency department admissions. For example, changing nasogastric tubes at home, changing tracheostomy tubes at home, changing catheters at home, putting on back slabs. So we can do the same for your hospital. We can do the same for your nursing home. You know, bringing that level of expertise into the home and avoiding ED admissions is of interest for patients at home, for patients in residential aged care, for obviously hospitals to offload their EDs. Now, if you're watching this and you're an NDIS support coordinator working for another organization and you're looking for nursing care for your participant, you know, we can help you. Or if you're looking for more insights how to advocate for nursing care through the NDIS, we'd love to help you. If you need an NDIS nursing assessment for your participant, you know, we would love to help you. We have done it successfully, otherwise we wouldn't be in business. Your loved one, if you're watching this and you are in a hospital and you're in a similar situation, either yourself or if you have a family member in a similar situation, please contact us at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And you might be at home already and you might have insufficient support. Like I said, all of our nurses have a minimum of 2 years critical care nursing experience. We are the only service in Australia that is actually accredited for intensive care at home nursing. We have built the intellectual property. We have built the teams that make intensive care at home possible. And obviously, like I said, our service is evidence-based. You know, there's no evidence that support workers can do the work that we can do. The evidence for support workers is that people have died. That's the evidence. Now, also, if you are a critical care nurse and you're looking for a career change, we want to hear from you as well. If you have worked for a minimum of 2 years in critical care, ICU, pediatric ICU, ED, and you ideally have completed a postgraduate critical care qualification, we currently have jobs in Melbourne, Sydney, Brisbane, Albury, Wodonga, in Bendigo, as well as in Warragul in country Victoria. We want to hear from you. We're looking for intensive care nurses and critical care nurses that want to complement our team, people who are team players and people who are looking for regular work. We are a service provider and not an agency. We do pride ourselves on providing a tailor-made solution to our clients, and that includes having a regular team, regular people working on with our clients. And if you are an intensive care specialist or ICU consultant, we are currently expanding our medical team as well. Please reach out to us if you have any interest in intensive care at home. And if you're an intensive care specialist and an ICU consultant and you have bed blocks in your ICU, you can reach out to us as well. We can help you eliminate your bed blocks. And more importantly, we can improve the quality of life and sometimes quality of end of life for your patients and their families, and you won't even pay for it. Once again, if you're a hospital executive watching this, we also want to hear from you because we can help you eliminate bed blocks in ICU and ED. And if you are in the US or in the UK and you need help, please reach out to us as well. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home, but also for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families. Comment below what you want to see next, what questions and insights you have. I do a weekly YouTube live. And if you're a subscriber to my YouTube channel, you can get notification there or subscribe to our email newsletter at intensivecareathome.com, and you will get notification there when I do a YouTube live. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.